Welcome to Medical School in 5 minutes, where we bring you topics pertaining to medical school that will benefit anyone in medical school or anyone who's interested in joining medical school. My name is Marie McGillicuddy, and I will be your host. Joining us today is Dr. Fakoya, and he is the Associate Professor of Gross and Developmental Anatomy and Histology at the University of Medicine and Health Sciences in St. Kitts. Dr. Fakoya has published in numerous journals and books in overseas research at the university. Dr. Fakoya, thank you for joining us today. I have one primary question for you. Why is conducting research in medical school important?
Well, Mari, thank you. Thank you for having me. And that's a very, very good question. Conducting research in medical school is an essential skill that every medical student should have. And it's not just a skill, it's also some, we have so many aspects that conducting research adds in general to the students. Let me start off by saying that one of the things that we want to impart in when medical students come on board is essential medical knowledge. Let's start off from what we call the Bloom's taxonomy. Some of you are probably familiar with the term called the Bloom's taxonomy. We know that we're talking about a 6-level kind of training that we want the medical students to have. The first level will be knowledge. I mean, we want to impart knowledge on our medical student, but that's not all. That's not all we want to give. We want to go on in medical school, especially not like other courses, but in medical school, we want to move on to the next level, of which we say of Bloom's taxonomy, which is a comprehension. Yeah, that means they understand, they know what, why this is done and why that's done. But is that all? No. We go on to the next step, which is application, and that is key. So most of the way we would test our students in medical school is all about a clinical vignette on how would actually the students would apply the knowledge they've gained in class or from little labs here and there into a clinical scenario. Now, the question Mary asks is, why is research important? You see that across most medical schools, this is probably where you're going to stop. Application of knowledge. Now, what takes us higher on the Bloom's taxonomy is research, because there's no way you really want to test analysis and maybe synthesis in the question format. So, but when we are as an institution and able to introduce research into the activity of the students and the activities, we're taking them higher than most other institutions will give, which is just application. So we can go on to another level, which is analysis, because from the research skills that they're going to get, they're going to be able to analyze several information that has been given to them from maybe several review papers. And also from there, we'll move on to the next level of the Bloom's, which is synthesis. So from several data and several information they gather from several papers, they are able to synthesize a new information, which is going to be very applicable to the medical and scientific community. So that is one of the key things that we look forward to when we introduce research into medical education. Of course, we know the last level of Bloom's is evaluation. It's hard at this point. Maybe later on, when they do go into residency, finish residency, then they can judge, then they can evaluate other information from all the professionals as well. But as a medical institution, we want to ensure that we get them to the peak of that knowledge. So that is one aspect. And that's one aspect. And that is one reason why we think research is very key to our medical education. I still have other ones. Should I go on?
Dr. Fakoya, we have 30 seconds left. Let me ask you something very quickly, if that's okay. Are there research opportunities if you go to a medical school in the Caribbean?
Well, there are research opportunities, but one thing I can tell you is that UMHS provides the richest research opportunities more than any other medical school that maybe you can say maybe one, some of you would have heard some other names, but when you put UMHS with all the medical school, in terms of research opportunities, we would rank in the over 90th percentile as to how much opportunities you get, which you will not get in most other schools. So that's one reason to choose UMHS.
Excellent. Thank you, Dr. Fakoya. And if you all enjoyed this, maybe I'll do an Instagram Live with Dr. Fakoya, because I think we have a lot more to speak about. But I want to thank you all for joining us today. And if there's a topic that you would like discussed, drop us a comment below, and then we'll see you on the next episode. Thank you so much.